Hi, this is Dr. Ram. Today I am here to enlighten you something about the antibiotics. Again, antibiotics are disproportionately used in majority of the cases. Actually, that is harm for the future generations. I agree. On the other hand, there is again lot of apprehension about the antibiotics. Most of the people presume that taking antibiotic produces a lot of weakness, but this is not actually true, and there is nothing like a powerful antibiotic or a powerless antibiotic. Antibiotics are again broad spectrum antibiotics and narrow spectrum antibiotics. So broad spectrum antibiotics are not powerful drugs to kill to actually produce a lot of side effects in one person. Actually, broad spectrum antibiotics, if they are used disproportionately, then without an indication, then there is a lot of resistance developed in the organisms, especially bacteria, so that future generations may not have any drug to use to get cured. So this is the problem with using, but many people presume that these broad spectrum antibiotics are in fact powerful, and these powerful antibiotics produces a lot of weakness. But when do you use antibiotic? We generally use antibiotic when you have a problem, that is when you have fever, when you have severe infections. So why don't you think that infection itself produces this kind of weakness? So antibiotics are never used in normal persons. Antibiotics are used in a person who have some problems, and but main majority of the people don't accept that their weakness or a lot of the fatigue or joint pains, whatever they have, that is because of the pre-existing problem for what they're using antibiotic. But they blame the drug for that, and they say that because after using these I have these kind of problems. And majority of the times what you see, many kind of viral illnesses, people come with cough, cold, and many practitioners, they do typhoid test for these kind of things, and actually typhoid test is absolutely useless test there. Majority of the times you will get a positive report by doing that test, but which is not at all related to the problem of cough and fever. There after the fever is subsided, you tend to have a lot of weakness and fatigue. That is actually a post-viral fatigue. But the story, on the other hand, you say that I got typhoid and I took an antibiotic, and after that I got to produce a lot of weakness. But this is actually not true. The truth is that the cough and fever is mostly because of virus, and after the fever or cough subsides, there is a lot of fatigue. That is called post-viral fatigue. So post-viral fatigue can go anywhere from 2 weeks to few months. In some people, it may go for few years also. That is called chronic fatigue syndrome. So that is not produced because of antibiotic. So again, my dear friends, always think before you presume things. That is, antibiotics don't produce weakness. It is the basic disease for what you're taking antibiotics produces weakness. To know more details about myths and facts and more details about any other health aspects, subscribe to my channel and follow on to my Facebook.